So now I would just slightly move from the topic of, say, personal development or something like that to a very prominent topic that had been lying since ages. And somehow I feel that our hierarchies have not been able to address this. And sometimes it is mismanaged as well. Talking in terms of the issue of general dentists doing orthodontics, my present way of thinking is that this thing could have been handled in a much better way. What I find is that we have alienated the general dentists since long. We have demonized them doing orthodontics. We could have devised best practices. We could have said, okay, fine, this is the domain. Come to our training programs. We'll train you how to help the visiting orthodontist in the overall delivery of the orthodontic care to the patient. Now, since I and many of my colleagues who are visiting orthodontists are having a symbiotic relationship with general dentists, so when we go to their practices, they generally have not a, I wouldn't say a negative sentiment, but they are hurt in terms of like your society thinks that we are like foreigners, we are not dentists, we cannot do anything. So how the new hierarchy that will be formed after these elections is going to bridge the gap between general dentists and the orthodontist, thinking, keeping well in mind that we both are having a symbiotic relationship, and just by alienating them, passing diktats, and even on social media, sometimes we see that there are marketing flyers being flaunted which slightly are not in good taste towards the general dentist. So how can we balance out our intentions and reciprocate them in a better way so that we are on the same platform, sir?
Very, very good question. Your question by itself has many answers to it. My take would be immaterial of elections or no elections. We are dentists first and then orthodontists. So we have to understand the sentiments of a dentist. He gives us the bread when we needed it. He has given us the cases when we wanted it the most. So we cannot demean a dentist at any cost. And as of what Orthodontic Society wants is, it is all, there are two sides of a coin. How we perceive it, it is different, and how it is being told, it is different. What an Orthodontic Society or any specialty body wants is, their particular specialty should not be, that particular specialty should always be on a higher side. It should never be let down by any of the works which are done. Now, supposedly orthodontic treatment, any child who wears braces is equals to orthodontic treatment, right? So whenever a general dentist would do it, if at all he would not have that sense, I would not say they would be even more talented than an orthodontist would be, but they would not have that much of training. So if at all any case spoils, that spoils the specialty. So that's what Orthodontic Society means. We do not say nobody can practice it. There is no law which can say that they could not practice it. If at all I can practice endodontics, they can practice orthodontics as well. But what we have to tell, more than educating the general public, what our aim nowadays is, public awareness. More than public awareness, we should aware the dentist what we can do. When a patient or a girl comes for a crown and bridge after she has a marriage after 15 days, we understand there is no other option. But if at all we have 6 months in hand, at least we can do some orthodontic treatment and try to cover up to the maximum, so that we are in the end, as in the last question what I told, we all have to be answerable somewhere. So do justice to your patient. If at all your patient requires implants, and if it requires uprighting of the molars or premolars, yes, we can always do it. So we have to educate the general dentist that yes, where all our need is there. If at all it is cleft, I would say in my terminology, it's a 13-year syndrome. Any patient who would walk into a practice, it will be orthodontist. If at all he comes to you, the dentist, general dentist would say, "No, sir, ये तो 13 साल के बाद ही होता है." Aajkal, kids are maturing faster. We would get permanent teeth at 10 years. So dentists would consider everything on a calendar age, not a dental age. You talk about nasoalveolar molding in cleft patients. Who would do it? In the end, that will be done by an orthodontist. So that is a 6 months job. Even at the age of 6 months, that has to be treated. So unless we do not aware the general dentists, our friends, brothers, sisters, we are all because of general dentists. We cannot tell anything against general dentist community as per se. We are orthodontists, we are fine, but you have to encourage them or explain them what interdisciplinary dentistry can do. So apart from what we see, bridges, vagara, implants, as I told you, cleft palate, temporomandibular joints, they would directly be the patients would directly be going to either ENT specialist or oral surgeon. They would be rarely being diverted towards orthodontist, which also is an issue. Now, because of increasing awareness, yes, the ENT specialist would be referring to the orthodontist, but we want the general dentist to have an orthodontist opinion as well. So, because we have a niche market altogether. Dentistry is a very small branch in all of the medical sciences, but in that also we have diversified into 9 specialties. So we have to cover up, explain whatever best I can do. So, in the nutshell, what I want to say is, you have to educate the general dentist first, and then they would, because they have more interaction with the public. If at all you tell the general dentist, then automatically more than the ENT specialist or any orthopedic surgeon referring your cases, your general dentist can give you much better, and we would be less bad mouthing the general dentist, because in the end what we want is business and we want good relations, so which our general dentist can always give it us.
Thanks a lot, sir. And the conclusion that I can draw from your words of wisdom is that there is a need and opportunity over here to have co-educative activities with the general dentist so that we are on the same page. And whatever happened in the past, whatever the inner feelings are like, this was bad and this thing was not done in the proper way, now we can have a fresh start with a new hierarchy, and we can bridge the gap, because obviously it will have ripple effects in terms of like the visiting orthodontist also getting more cases, and it's a win-win partnership rather than just being one side thinking negative about the other side.
Yeah, I would just like to add one thing. One time in my parent city, Jaipur, we were having a CD program in which I was lecturing. It was a general lecture about removable appliances to general dentists, and it was a medical company some lecture program. So I still remember I showed one of my case with Catalan's appliance, and to my surprise, we always an orthodontist, because we've been practicing for so long. I always think, yes, Catalan's appliance, Catalan appliance. But there were 4 dentists, senior most dentists of Rajasthan, who connected with me at that particular moment. Some later, they said, which appliance was that? Which was looking really small. They said we were giving some Holly's appliance with Z springs, and the patient sometimes breaks it, this and that. So what I mean to say is, what we are doing is, in the end, we are all here are healthcare workers. So we want to give our best to the patient, and with the minimum treatment time, we want the best given to the patient. So why not educate the general dentist that better than in certain cases who's a horizontal grower, or if we can see he's a young patient, he would be able to tolerate a Catalan's appliance, give the Catalan's appliance, get yourself free within 3 months, than the patient to run, the parents of the patient would run after for 1 year, keep Baba to you not wearing the plate, the doctor would scold, then he'll break one plate. So in the end, what we are doing is we are elevating the profession. The number of times, actually, there is a tendency of many practitioners to call the patients time and again. Me being a parent, I very well understand. I do not like going time and again. I want my treatment to be crisp and clear and minimum time frame. So that's how, if at all we teach and make our general dentists understand that these appliances are also available, and which is in their purview as well. Which is in their purview. Removable appliances in their purview. Any which ways they are correcting it with the Z spring. So if at all they can correct it with the Catalan's appliance, in the end, your community, your dental community would get more respect and more dividends. If you finish up work fast, your dentist would even more refer more cases because you've helped in this case. He would give you more fixed orthodontic cases. So it's a, as you told, win-win situation.
So thanks a lot, sir. Thanks a lot for the whole narrative that you have placed into picture, and I could also very well relate to it, and it's very pragmatic, so to speak.